How do we decide what the boundary should look like in a preterm infant or a baby in the NICU? Well, our aim is to reproduce what the baby had in utero, because this is where the baby should have still been. And even full-term babies, the first 3 months, the 4th trimester, is still a time when the baby needs that in utero kind of support. So a boundary should preferably be 360 degrees all around the baby, around the head, the feet, the body, the shoulders. It should support the baby to maintain nice flexion, similar to in utero flexion. It should also allow the baby to stretch and test the boundaries. So they will stretch a bit, and then there's a flexion, the extension, and then there's a reflex that's been triggered, and the baby go back into the flexed position in the midline. And that will help the baby to calm and relax. So if we look at our boundaries, if the baby is sidelined, for example, you want your boundary to be as high as the baby's hips level. You want the baby to have something firm to kick against, but it also needs to be flexible so that the baby can stretch a bit but go back to that nice flexed position. So it should not be a restrictive boundary that you use. It should be a reflexive boundary that you use, and it should help the baby and support them to get back to the nice flexed fetal position.